Kerala is grappling with a health alert that sounds like something out of a science fiction. But viewers, it is very real and deadly. Data from the Integrated Disease Surveillance Program has shown that Kerala has recorded 67 cases of a rare infection. 18 people have died. You may have heard it being called the brain-eating amoeba. Symptoms begin with fever, headache and stiff neck, but within days, they turn into seizures, confusion, coma, and usually leads to death. The numbers are alarming. Global mortality rate is over 97%. Very few survivors have been recorded worldwide. But what exactly is this infection and why is it so dangerous? Let's find out. We are joined by Dr. Sudhir Kumar, Senior Consultant, Neurologist, Institute of Neurosciences, Apollo Hospitals. Good evening, sir. Thank you for speaking with us here on Times Now. Explain to us, what is this mystery infection, brain-eating amoeba? Where has it really come from?
Good evening, and thank you for having this topic, which is very timely, and a lot of people have concerns and doubts about that. So coming to your question, what is this brain-eating amoeba? So basically it's an infection. And this infection, even though it's in the news now, but it is not something new. I myself have seen cases, while I was practicing earlier at Vellore, CMC Vellore, about 25 to 30 years back. And it has been reported from various parts of the country also, but currently we are seeing, surge in cases from Kerala. Now, this is an infection which affects the brain. So it's a type of rare brain fever, which is technically called as meningoencephalitis or encephalitis, and caused by amoeba, which is a microorganism. And there are two common organisms which are behind this infection. One is called as Naegleria fowleri, and second is acanthamoeba. So these are the two infections which lead to this, this rare and almost fatal disease.
It has claimed 18 lives already in Kerala. What are the symptoms to watch out for, in your opinion?
Yes, that's important also, because initial symptoms can be very, very, non-specific, like fever, headache, vomiting. And this triad of symptoms can occur in any brain fever. But rapidly, the symptoms can get worse and the patients can develop confusion, disorientation. They can develop convulsions or focal weakness of arm or leg, and they can even go into coma. So early stage symptoms are fever, headache and vomiting. And that is the stage, when a patient should consult a doctor for confirmation of the diagnosis.
Are there specific tests for this particular infection? For example, if there is somebody in North India, because right now we are seeing cases emerging from Kerala. But if in North India, somebody has the symptoms you just mentioned, should that person go for a specific test? How will we know if it is this infection or it's because of some other reason?
Yes, that's very important point. So infections or the brain fevers are common in all parts of the country. So we have different agents. So this particular infection, what we're discussing is acanthamoeba or amoebic meningoencephalitis, but there are other more common causes of brain fever or brain infections like viruses like herpes. And then we have sometimes dengue fever can also affect the brain, causing dengue encephalitis. And then we have bacteria, tuberculosis, fungus. So basically any person in any part of the country, including North India, if they have a triad of fever, headache, vomiting, and on top of that, if they develop any little bit confusion, disorientation, so that's very highly suggestive of brain infection. So they should go to the nearest hospital. And then, as you asked, there are specific tests for us to confirm. So initially a brain scan will be done, which can be CT scan or MRI, but that only gives indirect evidence. For confirmation, we have to go for something called a lumbar puncture, where a needle is inserted in the lower back and we draw some kind of what is called a CSF, cerebrospinal fluid. An examination of that clinches the diagnosis. So whether it is caused by virus, bacteria, fungus, or this amoeba, that can be seen on the CSF.
Okay. This is reminding me of that time when COVID pandemic started in the country. At that time also, suddenly from one state to the other, the number of cases started increasing, but we had RT-PCR tests, we had specific tests to find out, whether it is COVID or something else, whether COVID is there or not. But in this case, I mean, it's something which happens quite frequently among so many people. We've seen headaches, vomiting, etc. It keeps happening, especially when seasons are changing. It's the monsoon season. At times air conditioning is too high. These kind of symptoms we usually see around us also. So what should people do?
See, there are two parts to your question. Number one, you asked whether it can become like a COVID pandemic or whether it can rapidly spread to other parts of country. So chances of that happening is less because if you look at the route of infection or how it spreads, it is through water. The water has to enter through the nose, and then we have something called olfactory nerve or the smell nerve, and we have a small thin bone called a cribriform plate of ethmoid and that separates the nasal cavity from the brain. So the infection travels along the olfactory nerve and then enters the brain. So basically the infected water, the water has that has amoeba should enter somebody's nose, and then the infection has to travel to the brain. So basically it travels, the infection can be caused only that way. So this infection cannot spread from one person to other person, number one. And also it doesn't spread by drinking the water. Suppose the water was contaminated by this protozoa or this infection and somebody by mistake drinks it. So they will not get this infection. So that is a specific route of infection. And your second question was whether, because fever headaches are quite common. So how can somebody separate whether it's due to brain fever or just mild viral fever? So yes, I agree with you. If somebody has just mild fever, mild headache, then definitely it is due to viral fever. But if the headache becomes very severe and the person starts vomiting, so you can make out, a person who is just having viral fever, they'll have fever, mild headache, body pains, myalgias, but they'll be, they're able to do everything normally. But somebody who starts having severe headache or starts vomiting, so that's the time they should definitely meet a doctor, and doctor will be able to differentiate whether it's mild viral fever or whether it's going into brain fever. So even if it's not, this amoebic meningoencephalitis, as I mentioned, there are other organisms also that can cause brain fever, which are more common than this rare infection.
Okay. So as you're telling us, it infects people when contaminated fresh water enters the nose. So should one stop going to swimming pools? Is that the suggestion?
I think that's a very good question because, I think in areas where this infection has been identified, especially in Kerala, from wherever, which all sources or places where this infection has been reported. So there definitely people should become cautious. So especially if it is a stored water, like in swimming pool or say ponds or lakes. So this, infection is found in the stored fresh water. If it's a running water like river water or sea, it's not been reported.
Okay.
So definitely, so in those areas, people should be cautious. And of course, Kerala is a developed state, and the government is already taking multiple steps. So they're chlorinating the water, and they're making sure that the water is not infected and not contaminated. But till that time, if it's an unknown source or it's a private or public source of water, definitely people should be cautious because it happens by swimming, diving, and also taking bath in those water.
Okay.
As I mentioned, it doesn't happen. So only the water has to enter the nose. So any activity, and then there are some cultures where they have a ritual where they rinse their nose and nasal cavity by water, putting water. That is not recommended medically. But even if somebody is doing it, definitely sterile water only should be used and not any water from any other sources.
Who are most vulnerable?
Yes, so this, like any infection, this can occur. This usually occurs in the extreme. So children, or recently in Kerala, 1 3-month-old infant also was reported to have this infection, and older people. But this can occur in anyone. Basically, good number of this infective agent should enter the nose and through nose to the brain. So it depends on the number of those infective agents which enter. If it's a very small number, possibly it may not be able to reach the brain. It may stay in the nasal cavity. Then the infection will not happen. But extremes of ages are more vulnerable, but it can occur in any age group.
If it can occur in any age group, so I want to ask you one last question. What kind of precautionary measures should we be taking?
Yes, as I already mentioned, so the spread is through nose by taking bath, diving, or swimming in any fresh water. So any public place, if the water source like swimming pool, one should be very careful unless you are very sure that this is clean and not contaminated. Only then the person should enter. And even if you enter, keep the head above the water so that the risk of infection entering the nose is not very high. So that is one thing. But at home, if you take bath, the risk is very less. Even though there is one report from US where a person got this infection through contamination of the piped water supply. But that's only one case in the entire world. In the USA, it was reported, and they found that the source was, there's some slimy material on some pipes, which are old pipes, not cleaned properly. But generally in India, what we have seen is from the outdoor water sources. So there, the people should be careful.
Right. All right, Dr. Sudhir, thank you very much, sir, for speaking with us and helping us understand about this new infection that has now emerged in Kerala, and what kind of precautionary measures should one really be taking. Thank you very much for sharing with us such important information. Thank you.